Yeah.
Yes, so sorry, we will start recording with this station. Yes, we missed the first station. Sorry, my friends. But yes, we will share the station and the drive on the platform. Station number one. Yes,
Okay,
okay.
let
So this is
me.
actually the second station. Go ahead, Geraldine.
Okay, so did
For
you
the
want me
reference,
to?
send it please on the
The
WhatsApp.
reference is the COPD from the CTC.
I can share it here. One moment.
Okay,
I can
COPD.
share it. Just one moment. Yes.
Okay. Okay, I'm ready.
Okay, guys, who got a volunteer? Who's Geraldine?
Ala, it was Ala.
Right,
Okay.
move on.
Yes.
Ahmed, could you please manage the timing if you don't mind? Yeah, Geraldine, you can go on.
We can go on. Okay.
Just a minute. Hold on. I
Okay.
want to open the reference. Sorry.
Sure, no worries.
I send you the reference.
I have access.
Yes. Gazuli, I have a question for you. Why you are sharing the OSCE 2 group link to the OSCE 1 group on the OSCE 1 group? مش فاهم. طب بتحط اللينك ليه بتاع الجروب التاني من اوسكي على الجروب الاول؟
I was asking about the link and he put said to join the other
Yes,
one.
I'm sorry. I'm sorry, I was confused.
الغي يا عم البتاع ده.
Yeah. Yeah.
الغي طيب الغيه. Yes, okay.
Okay, just open the reference. So I'm ready.
Okay, me too. So let's start it.
Yeah.
One moment, please.
Sure.
Okay, start.
Yes.
Yeah.
Okay, so hello. Can I speak to the pharmacist? I need to fill my prescription, please.
Sure. Hi, my name is Ala, the pharmacist. How can I help you today?
I have this new prescription. Can you just fill it for me, please?
And first, I need to confirm your name is Mark William or William Mark.
William. You can call me
Right.
William.
Okay, William. So, and how old are you? Like 32 years old?
Yes.
Okay, great. And you're allergic to penicillin. Is there any update on that?
No.
Okay. So, what made you visit your doctor today, William?
Actually, he said that I had actually an acute exacerbation and I was hospitalized, and now he gave me this new medication. I don't know what is it. It's for what also, I don't know.
He give you azithromycin, 250 milligrams, 2 tablets in the first day, and 1 tablet, from day 2 to day 4, right?
Exactly. Hopefully, I don't know.
Oh, yeah. Okay. So are you in front of me? You're taking like Ventolin and the Flovent and the Spiriva. Are you okay with those medications?
Yes,
So are you well controlled?
I was, but I don't know what happened with the few weeks, and I got this acute exacerbation, as the doctor told me. So this is why I was hospitalized for 2 days, and now I'm out.
Okay, sure, I can help you with that. William, I need to ask you a few questions about yourself and your lifestyle. Is that okay with you?
Sure, go on.
Okay. Do you take any other medication away from the file, any over-the-counter medication?
No,
Okay. Do you have any other medical condition?
no,
Okay. Do you drink caffeinated beverages like coffee or tea?
yes, 1 or 2 cups a day,
Okay. And do you smoke?
2 or 3 cigarettes.
2, 3 cigarettes. Okay. We'll touch base on that later. Okay.
Mhm.
So do you have a chance to exercise?
Actually, I walk every day outdoor.
Okay. Okay. And away from penicillin, you don't have any other allergies, right?
No.
Okay, William. So, okay, can I give me a chance, please? I'll check my reference and I'll get back to you as soon as possible. Okay.
Sure, sure.
Thank you. Okay, thank you for waiting, William.
No worries.
So, are you familiar with what medication you received in the hospital? You said you was admitted.
No, but it was under the supervision of my doctor.
Okay, so your doctor has prescribed to you azithromycin,
Mhm.
okay, which is an antibiotic,
Mhm.
which is commonly used in such exacerbations. Okay, you're
Mhm.
gonna take 1 tablet, 2 tablets in the first day. Then, starting from the second day
Mhm.
to the 4th day, you're gonna take 1 tablet.
Mhm.
So I'm gonna give you actually 6 tablets instead of 5.
Mhm.
Okay, to fulfill the duration of treatment. Okay,
Okay.
this medication is well tolerated. You can take it like with or without food. Okay.
Okay.
But also there's some side effects you may or may not experience.
Mhm.
It might upset your stomach. So if this happens, you can take it with a small meal or something.
Okay, that's
Okay.
perfect.
Otherwise, you should be fine with that medication. You have any
Okay.
other question or concern?
From
me?
my side, no.
Okay. So this medication too, just kind of like it shouldn't it's a very rare to happen with using tiotropium. Okay, inhaled tiotropium. But if you notice any abnormal heartbeats, okay, you can call me or you can call your doctor right away. We'll let you know what to do.
Okay,
Okay.
that's perfect.
You have another question?
No, that's fine.
Is that clear? Okay. So this tablet can be stored in room temperature.
Mhm.
Okay. And keep it away from reach of children and and that's
Okay.
it. Thank you for coming by.
Thank you. Thank you. Have a good one.
One.
Thank you.
Bye.
Bye. Okay.
Was it Alaa? Was it Alaa? Alaa.
Yes.
Anyway,
Yes.
So what's the timing for that?
Okay, I have so many comments Alaa, actually.
Yes. I will just okay. I will just
I
say
will give
mine.
Geraldine actually the hand regarding
Okay,
therapeutic
I will
work.
just say, of course, minor comments. Of course, you will say better than me, but I will just let you know. First of all, you didn't offer me confidentiality.
Exactly. Allah
Okay,
knows.
so this is the first thing that you missed because you started directly asking about my lifestyle without taking my permission to that we're providing me confidential area to sit for that or just to talk to open the discussion for that.
Yes.
For the allergy, even you didn't ask me how severe was it, because if you asked me, I would tell you that it was hives, rash, shortness of breath. So this will alarm you that if you're going to give me the azithromycin, it's a good thing that you will alarm me again if you take the first tablet and you have any hives, shortness of breath, or rash. This means that you're anaphylactic to this medication too, and stop the medication and go to the emergency. So this person is allergic to something, so maybe he will be allergic to the azithromycin too, right? So you didn't ask about the severity. There is no cross, yeah, but with the new medication, he doesn't know what is he taking, right? So it's a good idea always to remind the patient that if you have any shortness of breath, hives, he has to go to the emergency directly because he may suffer an anaphylactic reaction, right? He doesn't know what he was taking, or did he take this before or no? He's allergic to that or no, right?
Yeah.
Also, you didn't, why you gave me 6 tablets if the doctor gave me 5 only?
Yep.
Because already on the first day I'll be taking 2 tablets, so this is 2, and day 2, 3, 4, this means another 3 tablets, so it's 5. So why did you give me 6? Right?
Wait a minute.
Mm-hmm.
How many days?
It's 4 days.
Okay.
But it
So
is
2, 1, 1, 1.
But azithromycin, is it only like either 3 or 5 days course?
But for the
Yeah.
acute exacerbation, this is, if you just go to the reference, you will see that it's on the first day. He has to take 500 milligrams, which is 2 tablets. And then day 2, 3, 4, it's only 1 tablet a day.
Wait.
Right?
It's
Mhm.
it's just a minute. It's
Mhm.
2 tablets in the first day
Mhm.
and 4 tablets plus 4 tablets. This is the
Plus
relevant
3,
COPD.
plus 3.
Check the COPD. I checked it already before I answer you.
It's 5 days?
Yeah.
No.
No.
Just check the table down at the bottom at the end of the chapter. The regimen is for 4 days. Right?
Oh,
Right?
that like the drug table in front of me says azithromycin. I will tell you, 500 milligrams once daily for 3 days.
Mhm.
Alternatively, you can take 500 in the first day, then 250 once daily for 4 days. So that means 5 days.
Yes, okay, I got you. Yeah. Okay, but
Okay.
again, okay, right, you're correct. I got you. I got your point, yes. So, but this means that this is with the expanded scope, perhaps you'll add this or what?
No, I have an interaction. Sorry.
Okay.
The prescription he got, he didn't dispense it properly. He dispensed it. I felt that he's monotonous. So I felt whatever he has in his mind, which is scientifically not bad, he just shoot it without even looking into the prescription he has.
Yes, he didn't. Oh, yeah, this is one thing more that he didn't go through the prescription. Yes.
Like he's therapeutic wise, he's good, by the way. Like
Yes.
he's really good. But my intervention with you is like communication wise. You didn't even show empathy at all.
Exactly.
This guy, he said, "You can call me William." You didn't even, "Hi, William, how are you doing today?" And then she told you, "Okay, listen, I'm just out of the hospital." You didn't say even, you know, "Oh, it must be bothersome for you. How can I help you? Like, let's go to a private counseling area or anything for that." You know what I mean? So that's
This is my bad. I
concern.
always forget this empathy.
And one thing more.
It's a critical issue. You're therapeutic wise, you're very good, by the way. But communication wise, which is our main dilemma here in OSCE, that's the big issue.
Exactly, communication.
Half of the marks, no?
One thing more, I just wanna, before I just lose this point, the thing is very important that when a patient is getting out from the hospital with COPD, that you recommend for him the pulmonary rehabilitation within 4 weeks. This is a high recommendation.
Come again, please. What's that?
The pulmonary rehabilitation. This is within 4 weeks after getting out, after getting the acute exacerbation. This is a high recommendation. That
am I gonna be the one to refer him for that?
You will recommend. So this was I was about to tell you about it, that you would take his permission to contact his doctor, tell him about the pulmonary rehabilitation as well as the prednisone, for example, or corticosteroid, because this is one of the recommendation also for the acute exacerbation. So these two things also you missed. And the most important thing that he was telling you, that he's going for a walk outdoor. And, you know, of course, if there is air pollution and dust, this will make things worse. So also within the monitoring or the follow-up or the self-care, just to be more efficient or more accurate, you have to tell them stay away from pollution, dust, anything that may exacerbate your condition.
That can be, Geraldine, that can be a bonus points. I
yes,
agree.
Yes. I'm just telling you, I always just go by sequence.
Yes.
So I just didn't want to miss this point too, because this will add. You know, in the last experience, it was very easy stations, but you need to add more in order just to show your excellence. Right?
Can I speak, please?
Yes, sure.
Definitely.
Yes, I am a COPD patient, and whom refer me to the rehabilitation is a family doctor. But I think the pharmacist can refer the patient like this to the occupational therapist to return to his normal life.
Yes, but also we have to take the permission from our patient, right? He didn't mention that at all.
Yes, but
this was my
the pharmacist couldn't recommend me to go to the rehabilitation.
As a pharmacist, we can recommend, but we not refer. There is a big difference
we don't
between
refer.
referring and recommendation. To recommend as an educator, you always can recommend anything as long as it's the best interest of the patient. Referring, that's an official transfer of care between two healthcare providers. That's totally different.
Sorry, Mohammed, but he is getting out from the hospital. I think the hospital will refer him automatically to the rehabilitation.
Yeah, but you have to mention that from where are they going.
If there is time.
Yes,
definitely.
Of course, it's bonus. Now, actually, if you're just if you're only aiming for the important points, you will go to the station and you will not say the important points. Always aim for more than the important points in order to be able to get the whole thing together. Now it's you're practicing from now until maybe for the coming 2 months or 1 month coming. So it's always a good idea that you practice the best, right? So when you go, because of the horror of the exam itself, you feel that you're going to lose some points, or you're going to forget some of the points. So it's always a good idea. I'm not saying that he didn't do the case. Of course, no, he did it very well. But the only thing, he is missing some very small points that would excel. That's my point only. But confidentiality, of course, it's very important.
Yes.
What about smoking status of this patient? Did you
yes,
ask
he
about
said.
it?
Yes, he said he will touch it later.
Okay. So did he offer any kind of vaccination as a recommendation?
No. Yes, these vaccines are very important too.
Yeah. Did he offer any kind of smoking cessation?
No.
Setting? Yeah. Okay. So all this, Ala, all this are very important point, my friend. Okay. There is actually like it's a we can say any kind like take it as a cliche. You know what I mean? Vaccines has to be mentioned as long as we have like a COPD, asthma patient, pregnancy,
diabetes,
diabetic type 1,
yeah.
autoimmune, compromised patients, stuff like this. It's like a cliche. You have to mention at least, okay, you know what? Make sure that your vaccines are up to date. So that's very important. Okay, my friend. My concern, your therapeutic wise, you're more than actually
perfect. Yes, he is.
My concern is that monotonous way of talking to a patient that is discharged from the hospital.
No empathy. Yes, correct.
Yeah, I didn't feel like, and she said actually, okay, my doctor gave me this, and I don't know what it is. I know that you mentioned it later, at the end of the when you were counseling on it. You said, okay, that's azithromycin, that's an antibiotic, but you can say, as a way of communication point, you can say, okay, listen, I know that doctor didn't tell you much about it. Definitely, I will address this while counseling on it. So that means, as a point of view, that like from a communication point of view, that means you're actively listening to the patient. You just don't tell him, okay, no problem, and go on with your, consequence. Anyways.
Okay. Anyhow, yes. Okay. The station, by the way, was very good. I like it so much the way Ala was communicating in.
Exactly.
It was yes. I would for in terms of confidence and communication, I would give him 11 out of 10 actually. Okay, he was so confident and everything was fine, but he missed, as you said, he missed some important points: confidentiality, smoking, and vaccination. Okay, and I wonder as well why he finished the station so early. Yes, he would. Yes, he would have the time to excel, as you say. He can recommend other things. He can recommend non-pharma technique.
This is why I was telling him that there are small points, because at the end, and this has happened with me in reality, that I finished very quickly, but I had something to say more in order to excel for that. So this is why I'm just passing this advice to you. Just you had time to excel more, into probe more in the vaccination, in the follow-up. I will call you tomorrow just to remind you that the first day it's only 2 tablets, and the second, third, fourth day they will be only 1 tablet. So you will make a better relation with the patient. This is what I meant.
Regarding, there is a question here from Haba. It says no need for confidential area for COPD patient. Confidentiality is by law. It's not something that we offer. It's by law. We have to do it. Otherwise, you're gonna be liable for this. As long as you are speaking to anyone regarding his health information, it has to be confidential. So it doesn't. It's not related to the medical condition. It's related to the information you're saying. So it's by law, you have to offer confidential area, as long as you're gonna, discuss health information. Okay.
Okay. Another positive point as well. It's the correction of the antibiotic. He gave him 6 tablets. Actually, I know this is the regimen for the azithromycin, and not so many pharmacists would do what you did. Honestly speaking, As a pharmacist, I believe you should have the audacity to make the change. You should have the bravery to make the right decisions and for the patient's interest,
6.
as you did. Okay, there's what
Yeah,
if you give him?
Because most of the time, doctor, like, getting like the number of tablets wrong. So,
Definitely, my friend, that's totally true.
Yeah.
Yes,
However, legally, you will be asked by the audit on this. So why you tell you, okay, so at this point, you have totally the right to use your expanded scope to increase either the amount of the tablets or to increase the strength or decrease the strength, no problem. As long as you do it in a proper way, documented, you have a scientific evidence for that. Totally right.
Yes.
but
It's my
look
bad,
out
sorry
here,
for
because here, no, look out here, because the guy, as much as I know, the guy was in the hospital, or he was with his doctor. I don't know. Sometimes the doctor do not prescribe the whole course. Like for example, you may see like macrobid. A macrobid, usually we take it for infection, for urinary tract infection for 5 days. You may find prescriptions that come with only 3 days. And you ask the patient why only 3 days. She would tell you that the doctor gave me already 2 days in the hospital. So I would only take 3 days. Okay. So similar situation could happen here in the OSCE, for example. It would be better as well if you ask, have you started the medications yet or not? Or have you started taking your medication or not yet? You got my point? If you suspicious about the duration of treatment or something.
دكتور محمد.
Yes.
ممكن بس خلي بالك من الروشتة مكتوبة صح، بس هو العدد بس مش أكتر. أنت فاهمني؟
انا لا بكلمك بموقف ثاني، بكلمك بموقف ده موقف ثاني.
I know, and I did try to explore more what happened in the hospital, and she said it was under supervision of a doctor, so I wouldn't think or comes to my mind that I should recommend like rehabilitation thing.
Yes. No.
Like I would.
Actually, I wouldn't do it as well. Rehabilitation thing يعني انا مش هقول للعيان، انا خلينا هنبقى رياليستيك وبراكتيكال في نفس الوقت. انا مش هروح اقول للعيان يعني روح اعمل ريهابيليتيشن واعمل مش عارف ايه من الاخر يعني.
In the exam, shouldn't we recommend something like that because it's a recommendation?
You can do it, but if you didn't, you won't be.
Yeah, it's an add up.
Exactly. It's
an add up. Yeah.
Exactly. Yeah, I cannot see like same thing like a smoking cessation. If just I mentioned it, that means I know what I'm doing, but I'm not gonna get into details to smoking cessation. You know what I mean? If you didn't do it, it's up to you. If you did it, it's.
He said it, yeah.
Yes, in contrast to vaccination, my friend. Vaccination here, it's one of the most
essentials.
Yes, essential points that you would have mentioned.
I have a question. I don't know if he asked the patient since when you are having COPD, because like when I'm looking at the prescription, it's originally from 2 weeks ago only. So if this is the case that he has been diagnosed with COPD since 2 weeks, and he just started these 2 medications, like all medications 2 weeks ago, there's 2 points. If we have time, we can add on. First, like asking for the technique if he is using them appropriately, and he asked about that. And the second one, tell him, you know what, like medications you are taking, there's one controller and one reliever. So the controller one gonna take few weeks to start to kick in and start working. So just kind of reassuring him that in a couple of weeks, he won't have kind of exacerbations by following taking the medication as prescribed by a doctor. Because maybe at one point he says like, I'm taking medication, doesn't work, get exacerbation and get hospitalized. So we can reassure him at this point.
Very good. Very valid point. Okay.
Can I make the other station directly and then leave because I have to leave? I'm sorry about that, doctors.
Okay, no problem. Go ahead.
Can I do the non-interactive too?
Yes, you can go.
Okay.
No problem.
So
yes. The next one is the non-interactive, right?
Yes.
Okay. I can
so there are 5 prescriptions.
Arwa,
want
she's
to,
raising her
do the
hand.
interactive, please, if I can.
Where?
If there is an interactive one, I need to do it.
في إن شاء الله بعد دي. بعد الجاية non interactive. We'll go for non. So Arwa, yes, you can just. Yeah,
Okay.
So can I do the non-interactive and the interactive, or what should I do?
No, only one.
Okay.
stage.
Okay, I'll stay till the interactive one. Yeah.
Okay, no problem. So you prefer the interactive?
Yeah, please. Yeah, thank you.
Okay. Okay. Any interested to take the non-interactive station, please? Gazuli, are you interested to take it?
With Geraldine?
Definitely, I can do it.
Yes.
With Geraldine, I think everybody intimidated now.
No, just
Yes,
cute.
let's do that.
Yeah, I can do it. It's okay. Hopefully.
Okay.
One more
So
time?
I'll share the screen.
Yes, go ahead. Do we have any other volunteers? Sorry علاء بس يعني
No problem يا باشا ولا يهمك. بس خلاص اللي عارف اللي هو خلاص يعني انت فاهمني خد العلقه الاولانيه فما عنديش مشكله ياخد بوكس تاني.
خلي كده ثيك سكين كده وجو ثرو يا مان في
ايه؟
مريم لا مريم عايزين بس اكبر عدد من الناس تشارك يعني.
Yeah.
Yes.
Okay, we think we can all do it. What do you think? We can all solve it, right? The non-interactive especially.
Okay.
Are you hearing me?
Yes. Yes, Mariam.
Okay. I can do it.
Very good.
Okay, so shall I share it? So it's 5 prescriptions and it's for dispensing.
And I answer after finishing the 5?
Yes.
Okay.
Okay?
Okay.
So once you're done, please let me know so I can just change the slide, okay?
Okay.
So are you ready?
Yeah.
Okay, so here you go. These are the first 2 prescriptions. I can hold the time if you wish.
Okay.
Ready?
Yeah.
Yes, go ahead.
Okay, let's start.
Yeah, I can see the second page.
Okay, so you're done with the first?
Yeah.
Okay, here you go.
I'm done.
Okay, that's good. we'll go for the first one. So how did you answer the first one?
Don't discuss. The label should be began.
So I cannot hear you, sorry. Can you say that again?
Don't discuss. The label should be marked began with AN.
Okay, so your answer will be that there is a problem. Patient name should be marked began with an A, correct?
Yeah.
Okay.
On the
Okay.
label.
That's it?
Yeah.
And how about take 1 capsule TID? Is it correct? Will the patient understand that this is what we write on the label?
Okay, 3 times daily.
Yes. So this is also, so you will write 6 should be take 1 capsule 3 times daily.
But I stopped there. I thought, I don't know. I have to note all the.
Yes, all the mistakes on the label. Now, there is two theory about that. I'm not sure what's correct actually, and about checking this. Now, some of the instructors, they told us that they check only one. Wherever you say that there is one mistake on the label, then this means that you solved the case. The other instructor told us, no, you have to get all what's wrong on the label and then you have to correct it. So in those label, actually we have 2, which is the last name of the patient, and TID should be 3 times daily.
Mm-hmm.
Okay, so it's a good idea always that you do the first one. So you write that patient name should be marked began, write the correct spelling, and solve the rest, go back again. If you have time and you're writing very quickly, then do the 2 at the same time. Okay.
Please, I have a question. In this prescription, if the patient's name was right and it is written TID also, should
3 times
also,
daily.
Yeah, if it wasn't written 3 times daily on the label, also this I cannot dispense it? If the patient name was right?
Yes, I cannot dispense it, yes.
3 times daily. Mm-hmm.
Yes,
yeah, okay.
Okay,
thank
now
you.
for the second one, how did you correct it?
Do not discuss.
I cannot hear you very well. Can you just raise your voice a little bit?
Yeah, the dosage form must be amoxicillin 500 milligrams.
Okay. But we can, okay, so you can say that it's 500 milligram. I just forgot to tell you, this is my mistake again, sorry about that, because it's my first time. So you can say that you can consider that the amount, whatever you have it, so we can say that amoxicillin 250 milligram, we can do it in another way, which is take 2 capsules 3 times daily. Could this be correct too?
Yes, it's correct.
Right? So the only thing that here I didn't provide you, this is my mistake, I didn't provide you with the picture that the bottle of the amoxicillin filled, but let's assume that it is the 250 milligram, it's the bottle that I filled from it. So we can just correct it as take 2 capsules 3 times daily. If what you're saying, so it's correct, the amoxicillin, the strength. So according to your answer, because of my mistake, it's correct, amoxicillin 500 milligram, this could be an answer. Okay, did you get my point? There is a mistake from my side that I didn't put the bottle that we filled from it, which is the 250 milligram. If so, if it was present, then the correction would be take 2 capsules 3 times
and
daily.
the quantity.
And the quantity then will be changed. That's very good. Okay.
I have a question. Sorry. I have a question here. So she said the mistake here is the dosage form. That's wrong. Dosage form, both are capsules. Strength. Okay? Yes.
The strength.
Form and it's a strength. Okay. So what matters here is the strength.
The strength.
Yes. Yeah. So if even if she didn't like put the filled vial, so if you please could get back again to a prescription.
Sorry, I'm sorry.
That's still a big difference here. You know, even without the vial. So that's still a big difference. It says amoxicillin 500 TID. 10 metate 10 here, amoxicillin 250 TID metate 10. So that's wrong.
Excuse me, Dr. Muhammad. For less confusion, if this label come like this without the picture of the medication or without any container of medication,
then the strength.
The strength. Yeah.
Then the strength, definitely, yes.
Of course.
Yeah.
Okay.
Yeah.
I have a question. Sorry, Dr. Geraldine. What I know from the website of PEBC that they say like correct the problem and don't kind of put a solution, like which means even if here the label is 250 and says take one capsule 3 times, and even it was like filled from the 250, so I can write here strength should be 500
Exactly.
and fill from the
No, you will not
container.
write this sentence. You will not have time to write this. You should be very short and very to the point. So what you have to say here, the strength should be 500 milligram. That's it.
Okay, but I will not go and correct it for him and say take 2 capsules 3 times daily. They don't like that. They don't want
if
that.
the bottle was there, that it is 250 milligram, then you will not write the strength 250 milligram. You will correct at that time the SIG, which is take 2 capsules 3 times daily, and you will correct the myth. Did you get this point?
Yeah, this is what I meant. Like on the website, they say don't like I'm not offering a solution for him now because this means I have 2 mistakes happen.
Not a solution, but if you kept it as take 1 capsule 3 times daily, he's underdosed, right?
No, I was going to tell there's 2 mistakes here. First, correct the label to be 500. Second, fill from the stock container, which is 500.
No,
because they are not
if they provide you with the 250 milligram, so you can change it to 2 capsules 3 times daily, and that's it, and then change the myth.
But this means I have to also count the number of capsules inside.
No, you don't have time for that. You're not asked to count. Just correct it.
Okay, it's very confusing right now because if he put 10 capsules inside,
you will not have time to count.
Okay.
Someday are 50, 100. You will not have time to count for that.
Okay.
Okay. So number 3.
Sorry, I got confused from the second prescription. I don't know what is the difference between if he gave me a bottle or didn't give me the bottle. Why my answer is different?
If it's something like this with no bottle, so the answer will be the strength should be 500 milligrams because the strength is not there, right?
Okay.
Now, what if he gave you the vial that the stock bottle that he filled from the medication? It's 250 milligrams. So 250 milligrams can take 2 capsules instead of 1, right?
Okay. So the correction will be not the strength. Okay.
It will be the SIG.
Okay, so I'll tell him give 2 capsules 3 times a day.
Exactly, right? And then you will correct the myth too, because it will not be enough for him to take 10 tablets. He needs
20 tablets.
Exactly, you got
it. 20 capsules. Okay, got it. Thank you.
You're welcome. Now for prescription number 3. I'm sorry, I cannot hear you.
Oh yeah, there is.
You can mute, however.
Yes. Hello. Okay. Prescription number 3. Hello.
Yeah. Okay.
So for prescription number 3.
There should be no refills on the label.
Okay, so what are you going to write exactly? Can you let me know, please?
Don't discuss. There should be no refills on the label.
Okay, so you will take more than it should be to write all this sentence. Just get it brief. Refills should be 0, right?
Okay.
Okay, what else?
Direction of use also must
Sorry?
be. The direction of use.
Yes, it should be
every morning.
Exactly, not once daily. You got it. Correct. Prescription number 4.
Number 4, the direction of use must be as needed.
Okay, so you got part of it. And how about orally? Do we write it on the label?
Yeah, I'm not used to say this orally.
Exactly. So it's take 1 tablet by mouth daily for 10 days as needed. Correct?
Yeah.
Perfect. Number 5.
Dispense, no words.
Exactly. You can dispense, no problems. Perfect. You got it then. Any questions?
Excuse me, Geraldine.
Yes, sure.
Please?
Sure.
Yeah, for RX number 4, the orally one.
Yes.
1 tablet twice daily for 10 days. The BRN.
Yes,
like,
she said as needed.
Yeah, and the quantity.
What
30.
about the quantity?
Quantity
30.
is normal, Ala.
Quantity is correct.
Wait.
Okay, whatever the doctor prescribed the quantity, if it's on the prescription and the same as on the label, and it is wiseable, of course, you can give it. Now, if it's only for 10 days and I said that give like 600 or 300, then you can question me at that time. You question the doctor, right? So, but here the doctor said give him 30 tablets and the label said 30 tablets. So it's correct.
But orally and by mouth, I think no difference.
Orally, it's not a patient language.
Actually,
right?
it's in the crawl. It's in the crawl. Like if you just type, it will be like interpreted into orally.
Okay, so whatever you see. But in the exam, orally, it's not a patient language. It's by mouth.
No, even crawl, it's by mouth.
I'm telling you what exactly. I'm just passing. Yeah, I'm passing. Go on.
Yeah, I will go back to the quantity again. Like, I used to work in a hospital and like, when you have a BRN and specified amount, you're giving the maximum, like, the maximum, if you could, like, take in like twice a day, like, without the BRN, it's 20 tablets.
Okay, but the doctor prescribed 30.
So
where's the problem?
Let me interfere.
Yes, sure.
Okay. So what is the meaning of PRN?
As needed.
Exactly. What does it mean by as needed? That means one day he may not take it at all. One day he may take it. One day he may take 1 tablet. One day he may take more than 2 tablets. It's so needed. It's not a regulated medication. So listen to me, Ella. Listen to me, Ella. So the quantity here, does it match logically? Does it match the
time frame or the interval?
The medication prescription or no? Like
it doesn't match that. Actually, it doesn't match the duration because
it's a narcotic or like it has an interval on it or something, or just
no, absolutely not. Absolutely, it's not narcotic. But I'm talking about
logically it works, and as long as we got it in the original prescription and we dispense it on the label, that's it will be wrong if you dispense it 20 only.
You can if you want. Actually, now this is only dispensing.
Dr. Mohammed, let me explain my point, please. If you talk it regularly for 10 days, it will be 20 tablets.
Yeah,
like
but
we have done. Like not even BRN. This is the maximum he can get. Like it should be 20 only.
Guys, what's
in
the problem?
10 days.
Okay, I get your point, Ala, but it's
no problem.
Let's cut it short, please.
Oh, go ahead.
Okay, here the prescription comes in PRN, right? It comes in PRN. We need it. Okay, if it's like that, 10 days when needed, and the doctor put 30 tablets, I would dispense 30 tablets. No problem with that.
Yeah.
Okay, but here your point is valid as well, Ala. If it comes only take 1 tablet for 10 days and no PRN and no other options, yes, so that's it. You can only dispense 20 milligrams and it would be fine. Okay, for me here, I would not dispense this prescription in that shape you have. Okay, because you have to mention PRN when needed. As long as it's not mentioned, you cannot dispense that.
And I think Dr. Sayed,
it's a regular medication. It's fine too. It's a anti-inflammatory medication, so it's fine.
You cannot dispense this medication in the exam if there is no known when needed written on the label. You cannot dispense it.
And one more thing, if there is an issue about the MIT, so it's not the issue in dispensing. You should have talked with the doctor before that and finished this issue before the dispensing step. Dispensing step, usually it's the last step that you agreed with the doctor what's prescribed. So here you agreed to dispense the 30, you're only checking for the label. This is the last step. If you have an issue with the quantity, so you should have talked with the doctor before that step. This is my point. Did you get me?
Oh, okay, Geraldine. Yeah, that makes sense. Yeah,
Yes.
Thank you for that.
Okay.
Yeah.
I'm sorry I have to leave, and I'm sorry for any problems I made today. Sorry for that, Ala.
No problems.
Okay.
Thank you so much, Geraldine, for the
You're
effort
welcome.
and station.
See you soon.
See you next
soon,
time.
inshallah.
Yes, bye-bye.
Inshallah.
Have a
Okay.
good night.
Thank you. Have a good night, everyone. Bye-bye.
Okay, prescription.
خلي بالك كنت طالعة ما تقفليش الميتنج بس عشان هو هيسألك.
Okay.
اعملي leave.
I will just leave it as mute and leave it.
Yes.
Okay.
Yes.
Is that okay?
No. You can quit the meeting, no problem. But make sure that you press only leave the meeting, not end.
Okay. Sure. Okay. Thank you.
Okay.
Have a good one. Bye.
Bye. So let's proceed. You are done with the non-interactive, right?
Yeah, I need to make the next station, please.
أروى ولا مين؟
Yes.
ايش يا أروى؟
Okay.
يلا بينا. ستيشن بتاعت
Kim Kardashian. Okay, so just I just need to see the.
Okay, one moment. I will send you the reference.
Okay. On WhatsApp.
Yes.
Okay. Yeah, just a moment. Okay, just a moment. Just a moment.
طلع جازولي؟
طلعت التشيك ليست بتاعت الستيشن.
مش عارف، ما خدتش بالي، انا كنت بعمل حاجة تانية. حد شافها؟
ماشي.
شفتوها صح؟
اكيد يعني.
مش تقول لي يا جدع، انا كنت بقفل البتاع اصلا.
ماشي.
Just a moment. Yeah.
شفت حاجة يا أروى؟
No, I'm just checking my WhatsApp.
طبعا الحمد لله.
Okay.
Okay, let's go. Let's proceed.
Okay. Okay. Yeah, I opened the reference. Yeah. Okay. Okay, let's a customer. Okay. ماشي.
Okay, for the time, please. Suelam is not here. خلاص سويلم. Okay, الستيشن دي أنا بحبها بصراحة. I love so much.
Can you start اللي هو I'm gonna take care of the timing.
Yes, ماشي. 7 minutes يا باشا، يلا بينا. Okay, أروى يلا.
Okay, let's start.
Anyhow, yes, I can give you 30 seconds or something to
Okay,
check.
you'll have 30. Okay, just I want to check. Yeah, okay, customer.
معاك الوقت يا جزيرة مش كده؟
Yeah, okay. Oh, so there is only 3 medications, or I cannot see the rest of the screen. Oh, okay, 3. Okay. Let's start. Yeah, hello. I'm Arwa, a pharmacist. How can I help you today?
Yes, pharmacist. I would like to have Plan B.
Okay, sure. Please have a seat in our private counseling area so I can help you more.
Yes.
Yeah. Can you please tell me your name?
Kim Kardashian.
Okay, Kim. How old are you, Kim?
I'm 34.
Okay, and how are you today, Kim? How was your day?
I'm 26, excuse me.
Okay, okay, Kim. Okay, Kim, how was your day today?
Normal day.
Okay, Kim. So how can I help you?
As I told you, I'm looking for Plan B.
Okay, so have you used Plan B before, Kim?
Yes, so many times.
Okay, I can see here from your profile. Can we check our profile, your profile together? So I can help you more.
Let's do it, my dear.
Yeah. Okay. You were taking Alice 21 tablets, 100 microgram, and your last refill was 45 days ago. You used it as a contraceptive, right?
Yes, I'm not using it anymore.
Oh, so why have you stopped it, Kim?
Yes, it gave me like swollen legs and like a strange sensations in my face and some headaches and etc. So the doctor told me I can stop it.
Okay. Have you used any other regular contraceptives?
No, not for the moment.
Okay. And I've seen here that you took Ella 3 days ago, right?
Correct.
Okay. And you are taking escitalopram for depression, and your last refill was 24 days ago, right?
Correct.
Okay. How long have you had the depression, Kim?
About 1.5 years.
Okay, Kim. How is it doing with you? Is it controlling your depression, escitalopram?
It's fine. Yes, I can survive.
Okay, great. So Kim, do you have any allergy to any medications? I see here that you have for peanut and pollen. Is there any new?
No, nothing else.
Okay, you took any other medications, prescription medication other than this on the profile?
No.
Okay, Kim. Can we ask you some questions about your lifestyle?
Yes, sure.
Yeah. Do you drink alcohol?
Sometimes.
Okay. How about smoking? Do you smoke?
Not so much. Not so much. Like about
Okay. And your exercise? Do you exercise regularly, or you
I
don't?
try.
Yeah, that's great for you. That's good for you. Kim, are you pregnant or breastfeeding by any chance?
No.
Okay, okay. So can I ask you, when was your last incidence?
Yesterday.
Yesterday. Okay. Can I ask you about your weight, Kim?
68 kilograms.
68 kilograms. Okay, Kim. So you need this Plan B. You don't need any regular contraceptives. You are not on any regular contraceptive right now, right?
Yes, as I told you, I tried the pills and
they are not
so many problems. Yeah.
Okay, Kim. Just give me a few moments to check my reference, and I'll get back to you.
Take your time.
Okay.
minutes left.
Okay, okay, Ella, thank you so much. I'll give you Kim plan B. Of course, what I want to tell you is that you take the 2 pills. It is 150 milligram of Novogestrel, and you take it one time, or you can take it different 12 hours between them. Okay.
You would give me 2 pills?
I think it's 2 pills. Yeah, plan B, right?
Yes.
Yeah, you can take them together. Okay, or if you want to take 2 times per day, okay, 12 hours apart. Okay, you will may experience some side effects of it, like spotting or breast tenderness, but this will go away. Okay. And what I need to tell you, Kim, is that if you're looking for a regular contraceptives, there is you can use another method of contraception other than the pills if they can do problems for you. Okay, are you interested in this? Like the IUD, it can be inserted in the uterus and prevent pregnancy for around 5 years. I don't know if you are looking to make a family in
Can you give it to me?
Sorry?
Can you give it to me, please?
Which one? The IUD?
Yes.
Yeah, it has to be, you has to insert it in a clinic or a walk-in clinic or at the emergency if you need to make it. It will be a very viable solution to you. And usually it doesn't cause that much problem that pills can do. So I just, I can call your doctor and suggest this option for you. Yeah. So yeah, and see if you can go right away or after. If this make problem for you, you can go to emergency and put it. Yeah. Okay. Yeah.
عايز اخدك يا ابني مش سامع.
خلاص. خلاص.
Time?
Yeah, time is yeah.
خلاص ولا
Yeah, خلاص.
طيب خلاص يعني.
Time.
Okay.
So it seems that you didn't see فعلا the checklist.
Oh.
Didn't see the checklist. Okay, this is good. Okay, do we have any other colleague who didn't see the checklist would like to redo the station? Very good, Darwa. Or we'll discuss it later.
Thank you. Okay.
Can I try again, Dr. Muhammad?
Okay, have you seen the checklist or no?
This patient profile you mean or what?
لا كان بتاع كده لا يبقى شكلك ما شفتش. طب يلا.
Sorry, you send it where? طب بعتها فين؟
لا بعتني ايه؟ لا
بعتها فين اساسا؟
حل الستيشن. I mean
we're asking do you have access to the reference?
Yes.
Okay. So we can start Muhammad. It's fine.
Can you see the reference, Muhammad, or no?
The reference I opened the both groups of WhatsApp. I didn't find the reference. What is the reference? I can open from CBS if you want.
No, it's not CDMA or something.
Where?
It's in the WhatsApp group in the OSCE station. Can you see it or no?
OSCE station on the RX group, you mean?
Are you in the WhatsApp group, my friend?
Yes. I see station 1. Is it?
Yes, that's it.
Oh, sorry. I thought it the first one.
No, station number 1. This is the reference.
Okay, let's start.
تمام.
يلا جازولي علي صوتك شوية بس يا جازولي الله يكرمك.
Okay, let's start and just started, okay?
Yes, okay.
Okay, hi, I'm Muhammad, pharmacist on duty. How can I help you?
Yes, my name is Kim Kardashian. I would like to have Plan P.
Sure, I can help you today. Let's have a seat in our private counseling area. Whatever we discuss will be kept confidential. Okay, Kim?
Sure, but yes, I don't have so much time. So would you please?
Okay. I see that you are in rush, but I would like to ask some questions to help you to solve your problem today. Okay?
Yes.
Kim, what's your concern?
I had sex with my boyfriend yesterday, and I would like to have a Plan P.
Okay, that's right. Okay, could I ask you some questions about your medical condition?
Yeah, sure.
Do you have any medical condition?
No.
Do you have allergies? Also, I see that you have allergy from peanut and the pollen. That's right, or there is upgrade for that?
Yes, it's peanuts and pollen. Yeah.
What type of? How do you describe this?
For peanuts, it's difficulty in breathing, and pollen, it's skin rash.
Okay. Okay. And for prescription medication, I see that you was taking Alice from long time ago. I think it's stopped.
No, I'm not taking it anymore.
Yes, and you took Ella from 3 days.
Yes, correct.
Yes, for another incident happened. That's right.
Yes.
Okay. And you are taking citalopram also.
Correct.
Do you have any side effects from citalopram?
No, it's well tolerated. No.
Well tolerated. Okay, and it is controlled for depression you are taking for?
Yes, that's fine. Yeah.
That's fine. Do you take any other medication over the counter like Advil, Tylenol, herbal medicine, vitamins?
No, not so much. No.
Okay. Do you consume alcohol or caffeinated beverages like tea and cola?
Only no, occasionally.
Occasionally. And for smoking, do you smoke?
As well, occasionally.
Okay. Do you have time for exercise?
No.
Okay. Not exercising?
No.
And your diet, describe it.
It's good.
Okay. Kim, could you give me a moment? I want to check my reference and come back to you.
Yes, sure. Take your time.
Thank you. Thank you for waiting, Cam. I'd like to ask you if you are breastfeeding or something like that.
No.
Okay, nice. Cam, I'd recommend to you to use another way, not plan B, as it is plan B, not plan A. So by regular using, it will lose its effect. And I see that you took Ella from 3 days. That's right?
Correct.
Okay, Ella is working for 5 days. Okay, that's mean you are still protected. And don't worry for any pregnancy probability, okay? But I'd like you to use another way of contraceptive, as you said that Alice is not working well, or you have side effects from it.
Yes.
Okay, I'd like to tell you that you can visit your doctor. You can use the copper or intrauterine device, which is levonorgestrel or copper, and your doctor will assess your condition, and he actually will be helping you with that, because using the intrauterine device must be by a professional healthcare practitioner.
Okay.
Okay. And for contraception, don't worry. You are taking Ella from 3 days, and it's working for 5 days. Okay.
Okay.
2 minutes left.
Time. 2 minutes left. Do you have any other concern?
No need for.
No need for what?
No need for emergency contraception, right?
It will not work because Ella will interfere with that.
So what I have to do now?
You are for 5 days protected by Ella.
Okay.
Okay.
So no need for contraception, right?
It's normal contraception acting now, but
okay.
But if you are not using regular contraceptive, I recommend you to use not Alice, as you told me that you have
So you
a
told
side
me,
effect.
okay, just because I want to understand what are you saying. You're
Mhm.
saying that I protected for 5 days, correct?
Yeah.
Okay, so I can have sex tonight with unprotected, it would be fine, correct?
Yeah, it's you are protected for 5 days.
Yes, very good. Thank you so much. Yes.
Okay. And if you want to not use hormonal way pathway for contraception, you can use another way, which is copper intrauterine device, which contains no hormones. Okay.
Yes, the device.
But
Yes.
I
Okay.
want to say to you that using all of these contraceptives will not protect you from sexual transmitted disease. So you must use any barrier to protect you from any sexually transmitted disease. Also, I want you to update your vaccines. Okay.
Yes, sure, sure.
Thank you. Do you have any other concern, Ken?
Okay, what's your name? You told me Mohammed, right?
Yes.
Okay, thank you, Mohammed. When I get my
Have a
baby,
nice time.
when I get my baby, I will call him Mohammed.
Okay, nice. Kim. Muhammad Kim Kardashian. It's a very nice name.
Inshallah.
يعني thank you so much.
Thank you. حملت البنت يا محمد.
حملتها ليه؟ مش الإلا 5 أيام.
You will get it very soon.
No, we can use it within 5 days of having sex, but if you cannot have
Exactly.
sex, yeah, you cannot having sex. I think if
Yes,
you have to
yes,
use
but
another.
if you... Okay, say your feedback.
Go ahead.
Back or doing it again or
بص يا باشا, let me, yes. When we are saying that ELA or Plan B is working 3 days or 5 days, it means retrospectively. Okay, within the last 5 days. If you had sex yesterday or the day before, you can take ELA or Plan B. It would be fine. They will be working. Okay,
Okay.
but it doesn't mean yes, I will take one tablet of ELA and I will have 5-day long sexual interventions and I will be protected.
Yeah, that you mean that she should put the copper IUD to this day today.
Well, the copper iodine could be, yes, it's theoretically it's a solution. Okay,
Yes.
it's a valid solution, but practically you have to check with the patient. If there is any chance to go to the hospital and a chance to go to the ladies clinic or
For
the
what?
clinic
For what?
to
For what,
insert
Dr.
the
Mahmoud?
IUD, my friend, to insert the IUD.
Yeah, I know, but if you give Plan B, how it will affect? How what is the effect? Because the receptors are blocked by ELA.
Have you checked the reference?
No.
Yes, that's it. That's it. You cannot give Plan B. That's it. You are correct.
Yeah.
100%. This is the answer.
But there's another reason. It's like over there. It's not just because, like, first, ELA is a prescription. It's not an over-the-counter medication.
Yes.
Second, in the reference, I don't know, like, you would like to tell, like, نحرقها ولا نكمل?
Go ahead.
Okay. 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 So it says, like, in the reference, you can take 2 different Plan B, like the levonorgestrel and the ELA at the same time or within 5 days.
Correct.
From each other, so you can't give them. And if, like, there's 2 solutions right now. The first one of them, either she can go to the doctor, walk-in clinic, whatever, and get another ELA, and this is a prescription only medication, or if she would like to have something for long term, which is IUD copper 1, because this one, the only one, can be used as emergency contraceptive and can be used up to 7 days, I believe. But the problem here, it has to be inserted by a healthcare professional.
Correct, my friends. Okay, so that's it. Simply speaking, as you said, you know the information by the way. You said it in the station.
Could I ask
I cannot
for a
give you
favor,
Plan
please?
B? So one moment. You said that I cannot give you Plan B because it will interfere with the ELA. Correct? You said that, and this is correct. It's very valid information. Okay, but your answer was totally catastrophic.
Okay, I want a favor. How to use this reference? Where is the
I
information we want to
highlighted
gather?
it already. Can you check? Can you see the reference here?
A lot of things
I
highlighted.
tried. Yes, but here it is.
How
Yeah,
long do
I
you
cannot
it's
highlight
the
only the answer to you. I cannot highlight only the answer to you. That's why I highlighted so many
is
things.
it, yeah, how many safe, how many times, something like that.
Here
So
it is. Here it is.
yeah.
Okay, don't use two different kinds of morning pills like Plan B and Ella at the same time or within 5 days. And you should know this information, by the way. It's pharmaceutical knowledge. Because they may, because as I said, you know it already, you knew it. Because you said it. Okay? So it's
actually?
not...
I get tracked in this point.
Yes,
Yeah.
yes. But okay, no problem. No problem. It happens. Okay.
Okay.
So the point in the answer would be as Muhammad was saying. أنت محمد ولا مين؟
محمد والله.
لا اللي قال الإجابة مين؟ أحمد محمد. صح.
لا أحمد بقى يبقى
Ahmed Muhammad, yes. He said yes. You can recommend to go to the clinic or hospital. This is number one. But as we said, this is theoretically it's correct, but practically you have to check with the patient. Number two, Ella. Here you have two options actually. This is my convenience. This is my convention. Okay. You can recommend fax a doctor or call the doctor or do whatever what you want to do with the doctor. This is number one. Number two, you can dispense Ella. You can dispense Ella as a pharmacist. Why? Because this is an emergency situation. You have an emergency situation. The patient, the Kim Kardashian, doesn't want to get pregnant. And what if she couldn't access her doctor? What would you do?
So you're gonna offer extended scope of practice that you're gonna make a renewal of the prescription.
Yes, you can say whatever. But here it is. She took already the Ella 3 days ago. Did you feel any side effects from that? Any intolerance? Any allergic reaction? Anything? You have to check this point with the patient. If she said okay, everything was okay. If she said everything was okay and it went well, so you can say that simply speaking, I will dispense you this medication and I will let your doctor know about that. However, this medication is a prescription medication, but I put in front of my eyes your interest and your desire not to get pregnant. Okay, so that's why I'm dispensing you the Ella as long as it was safe and you felt no
side effect.
Yes, undesirable side effects or something. So that's it. You have to mention as well that this is an emergent situation. That's it. In my perspective, this would be very, very valid and the best answer ever.
Yeah, this is valid answer. So you ask it about side effect, you're gonna fax the doctor, so everything is fine, and you already had a prescription before, so it's fine.
That's it. That's it. Okay.
Dr. Muhammad?
Go ahead. Protected sex too as well.
Dr. Muhammad?
Yes, Bish.
باشا معك علاء. بقول لك, can I say something here, please?
Yes, go ahead.
Like, as per the monograph of Ella, it's not recommended to use Ella twice in the same menstrual cycle.
Yes, correct. 100%. Yes.
So do we tell renew it?
It's not recommended, but it's not contraindicated.
Yeah, I know. It's
for
like
the Plan B as well.
difference.
By the way, for the Plan B as well.
Yeah, huge difference. Yeah, huge difference between not recommended and contraindicated. If I'm not comfortable to give it, shall I just speak it out loud in the exam,
as you say,
and I don't give it, and
yes,
yeah,
yes, you have to rationalize.
Rationalize why?
Yes, why you wouldn't give it. You can say what you say. According to my knowledge, according to the reference, it's not recommended to take 2 tablets of the Ella within the same menstrual cycle. That's why I do strongly recommend that you go to the hospital or go to your doctor or to go to whatever you want to go. Yes, that's it. It's totally judgmental, but as I said, you have to rationalize it.
Okay, thank you.
Okay.
For me, I would give. Actually, I would give 2 pills. There's no problem.
But
And
Dr.
for
Muhammad,
Plan B as well, it's not recommended to take two Plan B.
It is the same idea like the frequent use of Plan B. It's not recommended, but so many people does it, by the way.
Yes, it's yes, as you say, it's not recommended, but it's not contraindicated.
Yeah.
That's it.
Yeah,
Okay.
that's true. Like we have, like, we had a patient like coming every week almost.
Yeah, it happens. Yeah, that's totally true. Yeah.
Yes, so many times.
So Dr. Muhammad, like if I just tell the patient according to the reference here, just say like these 3 lines and tell him like to go and see a doctor or walk-in clinic or emergency, whatever the choice you like to have, and that's all, is still like fully solved? Or
if she's not comfortable with that solution, you have to make the things easier to her.
Yeah, will make your patient care like mark will be on jeopardy. So you have to make like like go with the patient best interest, you know.
Okay,
that's it. Yes.
I want to ask also Dr. Muhammad.
لازم تطبطب على العيان يعني من الاخر كده ومبسوط يا حبيبي ولا لا او حاجات زي كده.
But using of expanded scope is for a critical situation for the patient. Is it a critical situation?
It's emergency.
As I said, it's emergency situation. Yes.
Okay.
Yes. It's
there's something I want to say here. I remember, like, when I used to work in Saudi Arabia, like maybe 10 years ago, I remember I had an email from Medscape, and 2 pharmacists in America lost their license because they did not provide emergency contraceptive.
Yes, sure. Because this is, the patient doesn't want to get pregnant, and she doesn't know the information, the right information. It's your job to guide her and to refer her to the right place. Okay, that's it. You cannot tell her that yes, you can have sex tonight, no problem, and you are protected since 3 days ago. Okay.
Actually, he has a valid point here. If you look at the pharmacokinetics.
I'm kidding, Ahmed.
Like, it's only actually.
I'm kidding, because yes, this is information. By the way, you are not the only one.
No. I didn't mean anything.
You are not the only one who did it, right? Because yes.
I think here in the pharmacokinetics or something is mentioned there that it's preventing the ovulation for 5 days. It's written there in the monograph, but in the same time it's written it's only valid for 1 unprotected sex. Okay, but the pharmacokinetics and dynamics thing, there's some information there, like that it could mislead you if you are reading from the monograph.
Yes, maybe. But here, according to the reference here in the station, just you have to follow the reference you have. عشان ما نعقدش الأمور. That's okay, my friends. Very good. That's it. Would you like to have one more station? Gazuri, would you like to do one more station?
If you have anyone with you, I can go through it. No problem.
Okay. Okay. Are you done with for today, or you wanna continue with one more station? يا شباب عايزين ايه؟ واحدة كمان ولا نكتفي بهذا القدر؟ محدش بيرد، الناس عايزة تنام ولا ايه؟ Okay, so that's it for today. Thank you so much, my friends. So see you according to the schedule. I don't know when will be next session. Will be in 1 week, I think, or something. So that's it. Thank you so much, Shabab. Have a peaceful and excellent evening and night. تصبحوا على خير. Bye bye.
Stop the recording there.
Yes.